Hey, what's up, y'all? This is Danny from Fitness Saved My Life. I'm here with a special guest. We met at a women's conference a couple of months ago, right? Was it a couple of months?
Yeah, I think so.
It
A
hasn't
couple
been a
months
year
ago.
yet, right? It hasn't been a year.
No,
I think
no.
it
I
was
think it
over
was
the
like
summer.
around February.
Oh,
Yeah, or
really?
something. Oh, I'm way off.
Oh, it was
I just
before
remember it being
COVID.
cold.
Yeah, it was
I just
before
remember it being
COVID.
really cold, right,
Yeah,
before
yeah.
COVID.
Right, right.
So,
So yeah, we met around that time and we connected on social media. You're a doctor. You're into fitness. I noticed that on your social media. So I thought it would be
hmm
dope, for you to come on and tell your story, kind of inspire some people, give you insight from your professional perspective and
right.
personal. So welcome and thank you for
Thank
coming
you.
through. So
Thank you.
you're welcome. So quick question. So where you from?
I hail from Philadelphia, Go Eagles, and I
Okay.
grew up about 30 minutes away from Center City in Springfield, Pennsylvania. So it's a nice little suburban town outside of Philly. So
Nice.
that's where I grew up after. Yeah.
That's
hmm
cool. Cool. So how was your
yeah.
childhood? How was it like growing up in that area?
Well, well, I can definitely say, I mean, I had a really great childhood, but I know a lot of my friends out there can identify in growing in a Nigerian home.
Mm-hmm.
I'm a child of two Nigerian immigrants. They came here about 25 years ago, and
Mm-hmm.
just living under their roof. I mean, I'm not gonna
Yeah.
lie, they really pushed me a lot academically, for
Nice.
sure. And it was quite a challenge, but I'm really grateful to God that I had them, their
Mm-hmm.
guidance and direction during my childhood, because it's really brought me to this point. So I really thank God for that. But I had a really great childhood. Formed a lot of longing connections.
Mm-hmm.
A lot of friends, people from back home that still show me a lot of support.
Yep.
So yeah, honestly, I really loved how I grew up.
That's
So.
dope. That's dope. So
Yeah.
when did you know you wanted to become a doctor?
Wow, I get this question all the time. And honestly, it's really hard to say, like, of a specific moment in time.
Mm-hmm.
I always ask my father this because, from his point of view, been trying to get me to be a doctor since I was little. He would always give me, I guess, play toys with like stethoscopes and things like that. So he was already grooming me. But when I really, I guess, decided that I wanted to be a doctor was maybe in high school. At Springfield High School, we had this advanced placement course, and it really allowed senior high school students to work at the hospital and shadow a bunch of physicians, essentially going through different sectors of the hospital, working with
Yep.
respiratory therapists, nurses, CNAs, everyone from all fields, sectors of the hospital. And basically by doing so, I found out that, hey, I really like, what they're doing here. I really like that doctors are like the leaders, in healthcare, being in charge of the like pretty much all of the decision making. And then from then on, it really took off. I really just kind of set course, with my studies in college, that, what do I have to do to get to the next step of being a doctor? And pretty much from high school, it took off from there. So I would say definitely, shout out to Taylor Hospital, by the
Yeah.
way. They really helped me to really figure out that, this is something that I wanted to do with my life.
Mm-hmm.
So, mhm.
I wrote a speech on exposure and how important it is to expose yourselves or expose your children.
Right,
And that's a prime
right.
example. Like you said, your father was grooming you a little bit, but you having
hmm
that exposure and being exposed to the ins and outs kind of gave you the confidence and the passion to go forward with it. So that's dope.
Right.
Really good.
I can't
So,
stress that enough.
yeah.
Mm-hmm.
What type of doctor are you? What do you specialize in?
So I'm a resident psychiatrist. So
Mm-hmm.
essentially, I had already completed a resident psych doctor. Actually, is someone who has completed all 4 years of medical school, and they go through something called residency training, and that trains you under a specific specialty.
Mm-hmm.
And for me, I'm training to be a psychiatrist. So I'm a resident doctor right now, training in North Carolina. It's a 4-year program, and at the conclusion of that program, I will be reach a board certification to actually be able to deal with mentally disturbed individuals, prescribing medications, things of that
Yes.
nature. So that's essentially what I'm doing. My field is psychiatry. It's a blossoming field, as you may know. Mental
Yep.
health is no longer being seen as a stigma. It may be in the Black community, but now we're at a point where we're able to talk about it.
Yeah,
So I'm
definitely.
very blessed to be in this field.
Yeah, you're
Hmm.
gonna be a blessing in the field because, like you said, it's something that gets put swept under the rug, or
Right,
get the title, oh, he or she is crazy, but it's really
right.
some type of, sometimes it's a chemical imbalance, or things
Hmm.
that isn't diagnosed. And there's a lot of
Right,
men and women that are currently incarcerated where they should be in the hospital, because
hmm.
of outbursts that they've had, because of their mental illness. So you're definitely going to be
Right.
changing lives with that one. That's
I
good.
appreciate that. I appreciate that. Yeah, I
So,
agree. And yeah. Hmm.
so this may be a stupid question, and I know the
Okay.
answer, but some people don't. People always get this mixed up. So, like, what's
Yeah.
the difference between a psychiatrist and a psychologist?
Well, actually, that's not a stupid question. Because honestly, growing up, I didn't know the difference. Actually, I thought they were one and the same. So
Right.
that's actually an excellent question. I get that all the time, actually. Essentially, the difference. Okay, so psychiatrists or medical doctors, as I alluded to earlier, they go through 4 years of medical school, residency training, and at the end of that, they're able to, diagnose. Mental health, a variety of mental health conditions, and also prescribe medications. Now, where a psychologist comes in, they aren't medical doctors in the sense that they're not able to prescribe medications, but rather they play a very, very important role in dealing with the mental health community. They focus extensively on psychotherapy,
Mm.
otherwise known as talk therapy,
Yep.
and they basically help to treat the emotional and mental suffering in patients with behavioral intervention. That's very, very important, especially in the African American community. Psychologists play a very big role in intervening
Mm.
there, and so that's pretty much the breakdown. Is that psychiatrists or medical doctors, they're able to prescribe, diagnose mental health conditions, and psychologists use talk therapy. They're not able to prescribe
Got it.
for patients, but both are equally very, very important.
Yes. Thanks for clarifying that.
Hmm.
So getting into
No.
the fitness, I know you work out. So, can you give us a little insight on your fitness regimen?
Well, so I recently started this. Well, I'll start, kind of from the beginning. So prior to medical school, I had a lot of hobbies where I'm actually used to like weightlift,
Hmm.
and I don't do that anymore. And now I kind of focus more on like cardio, more intensive exercises.
Hmm.
I recently took up this 6-week challenge that I'm doing at my local gym. It basically involves boxing, and I found that to be a huge stress reliever.
Yes.
And I try to do that about 3 times per week,
Hmm.
boxing, and we're gonna do some kettlebell workouts later on in the week. So pretty much that's what I've been up to
Nice, nice.
as far as with my fitness regimen.
And do you
Pretty simple.
that's good. And it's consistent.
Well, I'm not gonna lie, I've fallen off the wagon a couple of times,
Well, we're gonna get
and
into
I
that.
hate.
We're gonna get into that. We definitely
Yeah,
gonna get
yeah,
into
definitely. We need to.
that.
Yeah, I have
um,
fallen off the wagon. Not gonna lie. So
yeah. I mean, we all do. Trust me. I'm a
yeah.
trainer, and I have my moments.
Hmm.
Personal things get in the way, but you gotta stay
Right, right.
disciplined through distraction. Try to say that all the
Right,
time.
that's true. Amen to that. That's true.
So, as a psychiatrist, do you recommend exercise as a coping mechanism for mental health?
Absolutely. I don't know if you know, but exercise, high intensity exercise, okay, they release these chemicals called endorphins, and that's
Hmm.
what we refer to as, the runner's high. That those feel good
Yes.
chemicals in your
Hmm.
body, and they have a variety of health benefits. So I definitely believe that it's a great adjunct or addition, to dealing with mental health. Now, for patients that I've encountered with severe depression, right? Patients with schizophrenia, people that hear thoughts,
Yeah, yeah,
have a distorted view of reality, things of that nature. Exercise will not be enough to help with
mhm,
that. People
absolutely.
who are in severe mental health crisis, exercise alone is not enough. It's also, obviously, of course, with antidepressant medications, we know that
Mhm.
they're commonly treated for dealing with depression, but pills are not the only solution.
Right.
I believe in a combination sort of thing. Both antidepressant medication and exercise are
Mhm.
things that are really work well hand in hand, to help with depression.
Absolutely.
But essentially, yeah, exercise is it's your natural antidepressant. You can't
Mhm.
go wrong with that.
Yeah,
So for
that's
sure,
it
for
is
sure.
definitely. So
Hmm.
speaking from a personal point of view, so I have
Hmm.
anxiety.
Okay.
I've suffered panic attacks, and
Hmm.
so I have to really be mindful of my triggers and things like that. And I
Hmm.
remember one day I was coming home from the gym. No, I was actually going to work from the gym in the morning,
Hmm.
and I was, up and I was drinking coffee, and I'm
Hmm.
in my office, and I'm like feeling antsy, and I'm like, then I start feeling shortness of breath. I didn't know I was having a panic attack until I went to the
Hmm.
hospital, and they told me that it looked like I thought I was having a heart attack. And then
Right, right.
when I mentioned what I did for the day, and I told them, I exercise, I did a real high intensity
Hmm.
exercise, I drink coffee,
Hmm.
and they said sometimes exercise can trigger anxiety. Is that true, or was that just something the doctor was telling me?
Well, I mean, I won't say that that's entirely incorrect. Exercise essentially increases the oxygen demand in your body, right? Your heart rate
Mhm.
is increasing, your blood pressure, things of that nature. So essentially, you're kind of in like a fight. I don't know if you've heard of this, but the fight or flight response.
Yep,
Your whole body's working extra hard, right?
yep.
So for some people, yes, exercise can cause a little bit of anxiety reaction. Now, you mentioned that you drink coffee.
Hmm.
Coffee, caffeine, things of stimulating chemicals, things of that nature can actually increase your anxiety. So, I'm a coffee drinker, not even gonna lie. I mean,
Yeah.
it's pretty much, I drink at least 2 cups of coffee per day, but you
Hmm.
really need to be cognizant of that because coffee in itself, caffeinated beverages can also increase or heighten or worsen your anxiety.
Absolutely. Yeah.
And also in triggers, being aware of certain triggers. Are there certain thoughts,
Hmm.
certain thoughts that you're thinking can
Yep.
also lead to anxiety. They can take on a snowball effect. So
Absolutely.
just paying attention to certain things that I guess paying attention to your daily routine, whether it's coffee drinking, whether it's what you're thinking, certain hobbies, things of that nature,
Hmm.
that can all worsen your anxiety. So I
Gotcha.
won't say that they're entirely incorrect.
Yeah.
Um,
Okay. Yeah, I
yeah.
believe them, but I just wanted to, since while I
Yeah.
have you here, let
No,
me
that's
ask you.
good. That's a good question. No,
Yep.
that's a very good question.
So,
Hmm.
back to fitness, back to you. Have you ever had a moment of like being unhealthy and out of shape? You said you kind of fell off, fell off in the past, but so that's a yes. So, how did you get out of it?
Many times, honestly, it's a constant struggle,
Hmm.
for sure, especially in dealing with work. I hate using this as an excuse, but being a physician, constantly working under pressure, you know, trying to be perfect, essentially. You're dealing with lives constantly every day, and there's really a low margin for making errors. So in dealing with that high amount of stress, I've turned to food, things junk food, pastries were my go-to, not sleeping, not exercising, things of that nature.
Yeah.
And it's pretty much been fluctuating, but now I'm at a point where I'm like, okay, like this is not working for me. I started noticing changes in my body and even how I felt at work.
Hmm.
I just didn't feel on point.
Yeah.
And for me, that can be a problem in dealing with mentally ill individuals. So, I really took it upon myself to. It really starts with the thought, the mindset
Hmm.
that you're done with this. You got to take action. It really just started with me in thinking that way. And recently, like I said, I started this 6-week challenge. It has me feeling good.
Hmm.
I'm more cognizant of what I'm eating. I'm not going out for take food like at Popeyes or anything like that, turning to the pastries.
Yep.
So it really just starts with, um, you know, that one thought. Are you really happy in your situation where you're turning to the pastries? How does your body feel in response to that? So in that way, I was able to get out of that unhealthy
Okay.
cycle.
Yeah,
So,
I found, when I was like unhealthy, and once I
hmm
made that shift to living a healthier life and focusing on
right.
exercise, I noticed
hmm
that every area in my life improved. Like I was a better
hmm
parent. I was more patient with my kids. I tackled and handled problems a lot better with
hmm
more confidence. And I was better with money. I made just better
Right.
decisions. And I just think that all is credited from fitness and being
Right.
of sound mind. And like you said, when you eat bad and you um, aren't exercising, you just don't feel good, and that could
Right.
turn into making worse decisions in other areas. So I
Right.
definitely agree with that 100%. Um,
Yep. That was spot on.
Off the camera, we talked about a mentor, and
Yeah.
I know your mentor. We both. I don't know if you want to say her name, but do you have a mentor like currently now, or more than one? I kind of have about three or four that I follow.
Yeah.
But what about you?
Yeah, I do. I actually just I speak to this woman every like single day. She's my best friend. It's my aunt Chama.
Mhm.
She's a healthcare compliance manager, and she's just been a mentor for me throughout all of my years of medical school and beyond. She's just a really strong life force. Whenever I have any lows, whether it's with work or just in general, she's always there for me. And also my dad. I mean, he's my best friend, for sure. He's someone that I could talk to like every day, just constantly motivating me, and in my pre-medical career, that's something that I found to be very, very helpful and effective in keeping me on track. So just shout out to both of them.
Well,
And in terms of people out you follow, do you mean like on Instagram,
well,
like
that too. I
celebrities
have,
or what?
I have, I have
Mm-hmm,
celebrities and motivational
mm-hmm,
speakers that are my
mm-hmm.
mentors, and they don't even know it. But yeah, can you name someone like that we all may know? Maybe like a motivational speaker or entrepreneur, someone.
Mm. Yeah, Dwayne Johnson, The Rock. I
Mm,
mean, I've watched him since, as a little kid in WWF. It was known as WWF at the
yep,
time.
me too.
But The Rock, you all know him as an actor. I mean,
Hmm.
philanthropist. I mean, he's just his work ethic. I mean, wow. I've read journal articles of him just waking up at 4:30 in the morning to start his day. I mean,
Yep,
he's a no excuses type of guy, and I
yep.
really love that. He's
Hmm.
someone that inspires us to be the best version of ourselves, and also he's really all about positive thinking. Because when you have a healthy mind, a positive mind, I mean, it's just so amazing. Your whole environment changes,
Yep.
and he does a really good job of sharing that with fans. So I could ramble on and on
Yeah,
about The
yeah,
Rock, but he's just my biggest
yeah,
inspiration right now.
definitely.
So shout out
Yeah,
to The Rock.
I love the rock. I wish she did more like interviews and public
Yeah,
speaking. He
right.
does them some. When he got a movie coming out and he's dropping
Yeah,
gems
yeah,
in. But
right.
I like every time he speaks, it's like, oh, all ears are listening, and like you say, he's motivating. He's always positive. He's a family
I
man. His
agree.
daughters. And when I heard he
Hmm.
got COVID, I was like, remember his whole family caught it. I was like
Oh my
scared and like,
God.
oh my God. But he's a
Yeah,
strong dude.
I
He's
was
healthy.
concerned.
Yeah, but
I was concerned. Yeah, maybe you never know. Maybe one day you'll interview him too.
yo, that's
You
the
know,
goal, right? Put
how
it out there.
fitness.
Put it in the universe.
Yeah,
Definitely.
gotta manifest it.
Yep.
Manifest it. So
Someone
yeah.
else
Hmm.
who I like to listen to and watch is Kevin Hart.
Kevin Hart. Okay.
Him and The Rock are really good friends. So that's what made me think of him.
Yeah.
But he's someone else who's like very motivating, very positive, and
Hmm.
he's always trying to put people on fitness wise, comedy wise.
Hmm.
So yeah, they
Right.
both. I follow both of them.
That's
Their
dope.
careers
That's
and
awesome.
personal lives. So
Hmm.
how has fitness? I mean, we talked about it a little bit, but let's get in more detail. How has fitness benefited your career and personal life?
I mean, pretty much, all of you had really said, you mentioned a lot about how you're able to think clearly,
Mm-hmm.
managing your finances, even in dealing with your personal relationships, with your
Yep.
kids and all things of that nature. For me, Pretty much the same thing. I feel like I have a healthier, clearer mind.
Hmm.
I'm able to think things through. My stress has been significantly reduced.
Yes, yes.
I mean, just in dealing with mentally, ill patients, you really need to be of sound mind. You
Hmm.
really need to have be just you really have to have a very strong mind of dealing with these sort of individuals, and I really feel like fitness has benefited all aspects of my life, spiritually, mentally, physically. And so I'm able to, I don't know, I just see a lot of the benefits. I could go on and ramble about it, but I mean, it's just multifaceted how much it has benefited me.
Yep.
So, mhm.
Did you notice like an increase in your patients since COVID? Like an increase in the number of patients you have?
That's a good question. Kind has been fluctuating actually in North Carolina. I would say now, as we're approaching, I guess the winter months or flu season months, I
Right.
have seen an increase of patients. Now, I'm lucky, honestly, to be in a field where you're constantly getting an influx of patients, right? As opposed to
Mhm.
other fields, like the restaurant industries has significantly suffered.
Right, right.
They've seen a decline in clients,
Hmm.
unfortunately. But with the hospital, I mean, you're getting constant influx in patients. For me, pretty much the last couple of months, yeah, I'd have to say I have seen an increase in the amount of patients. And it's really you really just have to be on point with a lot of this. Always wear your masks.
Hmm. Yep.
Vitamins are key. I mean,
Yes.
COVID has been unrelenting. We've seen better months where COVID rates have gone down, but now it's just been
Yeah.
skyrocketing, and
Hmm.
we really have to stay on guard with
Yeah.
this for sure. So,
Definitely. I was a friend of mine on Facebook. He's
mhm.
against wearing masks, so he's always
Oh,
like, don't be sheep, and and he says something about how 98% of people that contract COVID survives, which may be true, but there's also studies showing that is having like long-lasting effects on people even after they survive
right.
it.
It is.
So I don't want to get it.
Hmm.
Like even if I do survive it, who knows how it's gonna affect me later on in life. So I do
Exactly.
tell people to wear their masks, and listen, it doesn't hurt. You'd rather be safe than sorry, and
Exactly.
I think it's very important to
Exactly.
promote that. So
Yeah, I appreciate it.
yeah, what's your definition of success?
Wow, that's a very good question. My definition of success is basically, setting up your own personal goals and meeting your own expectations. Success really, a big part of success is not comparing yourself to others. And oftentimes, when we look to our neighbor on the left, we see that they're setting goals, maybe at a quicker pace or much more quicker pace than us, and we want to jump to it and meet their same expectations. It doesn't work like that. For me, setting personal goals, small or large, and meeting my own expectations is really my definition of success, and also just keeping in mind that you're not always going to be successful. That's really how life is. It's kind of like a roller coaster.
Yeah.
You're going to have some ups and downs, but you have to have a lot of grit, and persistent, and of course just just stand in your lane, not comparing yourself to other people, just doing what you got to do, pretty much. So.
Absolutely. Dope, dope. So this is kind of off script from my question, but I want to ask you, do you have anyone that you mentor? Now that you're in your position, your professional position, are you paying it forward now?
Yes, and I'm glad you brought that up, because even when you feel like you've reached, that height of, for me, I finally reached my dreams of becoming a medical doctor, but it doesn't stop there. And I know, shout out to Jacqueline Glass, Dr. Jacqueline Glass. I mean, she's all
Mhm.
about paying it forward, through
Yeah.
her programs at the Well, young women's leadership conferences. She's all
Mhm.
about paying it forward. So
Absolutely.
I do have many mentees, people that I mentor, men and women, those who are looking for a career in medicine,
Mhm.
especially that I mentor. And it really is something that also makes me feel good. It's not just exercise that makes me feel good. It's giving back to the community, the minority community specifically, teaching them some things that I didn't realize growing up in my medical school journey. That's something that I found to be, I don't know, really fulfilling in my life. So I'm all about that. I have plenty of mentees,
Dope.
people I'm mentoring right now. So how about you? Do you have any people, individuals
Um,
you're mentoring right now?
yeah, I do. I actually, one, my kids, they're my first
Hmm.
ones, definitely.
Yeah.
But yeah, so speaking of Jackie, I was a part of her at the World Conference. She did From the Fire, where they brought out young men to Princeton University
Hmm.
for 2 weeks. So I was a part of them for two years now. This past year, obviously COVID, kind of everything was done virtually. But I went out there, I was with the boys and put them through workouts, talked to them about business, entrepreneurship, stayed in touch with some of them, through social media. A lot of them picked my brain about, like I said, the fitness business. And
Right.
yeah, I have um, a friend of mine, his son wants to get into real estate because I do real estate
Wow.
as well. And so now I'm kind of teaching him the ropes and showing him, you don't always necessarily need a lot of money. There's other ways
Right.
to get funding and creative
Right.
ways. You just need to know the business and know what you're talking about.
Right.
So different stuff
Right.
like that. And then constantly paying attention to, what I post on social media because
Right. Right.
everyone's watching and I
Right.
try to put good energy out there. I try to put
Hmm.
positive energy, inspiring energy. I don't put
Right.
my opinions too much on, politics or
Hmm.
personal stuff because, unless you learn from me, I don't see no reason of, putting my own personal thoughts out
Hmm.
there about certain situations.
Hmm.
But
Hmm.
yeah, so I feel like I mentor people that I don't even know I'm mentoring because sometimes people
Hmm.
come to me later and like, I've been following you and you inspired me and I didn't
Yeah.
even know. So
Yeah.
definitely.
That's
And I
true.
love
That's
that.
true. That's
Um,
awesome.
so what's one of your biggest accomplishments?
Wow. That's a loaded question, honestly. Just,
Well,
I mean,
give
the
me a
thing,
few of
the
them.
thing,
I'll take them
I
all.
can't even think. I mean, I have a lot. I mean, just making my parents proud. That's my
Mhm.
biggest accomplishment. Just graduating from medical school. I mean, honestly, that was my biggest accomplishment. And just, just there's so many obstacles I've encountered, especially as a minority, that I'm like, I could go on and on about it. And just finally walking across the stage with both of my parents cheer me on,
Oh
like,
man, yes.
that was just the greatest moment of my entire life.
Hmm.
Out of all the accomplishments, was just making my parents proud and that they were alive to see that.
Yes, yes.
And um, and of course, just my daily accomplishments, and again, just being a mentor to the youth and just showing them the tricks of the trades, things
Yep.
that I messed up on that I wish I could have changed growing up. And I mean, those are my accomplishments, pretty
Definitely.
much looking back. So
Definitely.
yeah. How about you? What are your accomplishments?
Oh man, one, becoming a father. I was a teenage father. I started young. My oldest son is 17. I'm
Oh,
36, so I was
uh-huh.
19 years old when I first had him, and making that mental switch. Like I grew up in the projects. I was,
Hmm.
making bad decisions, but once he was born, it just changed everything.
Wow.
And it changed my way of thinking and my thoughts became it wasn't just about me anymore and I need to do
Hmm.
right and I needed to be a positive role model for him
Right.
and it just started me in the right direction because statistically I shouldn't have made it or I shouldn't have been here my son shouldn't be where he's at and I shouldn't be where
Right.
I'm at
Right.
statistically so just to break that mold and that statistic was an amazing accomplishment
That's awesome.
and
That's awesome.
yeah, I got into law enforcement at
Hmm.
23 years old. My mother pushed me
Wow.
in that direction. So that was like same thing, making her proud.
Right.
The sad part is, I graduated in December from the academy, and then she passed away in February.
Oh wow. I'm so
Um,
sorry.
Thank you. But it just I was
Yeah.
happy she got to see me
Yes.
graduate. And she was so
Mm-hmm.
proud that day. We took a million pictures. So I have so many memories from that day.
Wow.
So that was one of
That's
my
good.
greatest accomplishments, being a father and making my mother proud through my career
That's
choices.
awesome.
Yeah,
Yeah, that's true.
definitely. So before we close it out, like I feel like we could talk forever, but I want to stay on track. Maybe we'll have a part two. And
Yeah,
maybe
that'd be
after
great.
your 6 week, I want to know how that went. Your 6 week
Yeah, for sure.
challenge.
That'd be awesome. Mm-hmm.
So I want to do like a word association game. I didn't tell you about this, but it's like
Oh
rapid
God,
fire.
yeah.
I'm gonna I mean you could choose
Oh
not
man.
to, but you're pretty quick on your feet, so I know you can get it. So I'm just gonna say a word, and you just tell me the first thing that comes to your mind. It doesn't have to be a one word answer. You can elaborate if you want, and just tell me the first thing that comes to your mind. All right, you ready?
Okay.
All right, first one, education.
Oh wow. Nigerian household.
Mm, yes, can you push that 100%?
Yes.
Um, Quarantine.
COVID.
Mm-hmm. 2020, COVID, right?
Oh
2020.
God. The worst, but the best is yet to come.
Hmm. Absolutely. Freedom.
Wow. That is really stopped me in my tracks.
You got
I'm gonna
time.
have to think on that one.
All right, we're going back to that.
stop me, stop me in my tracks. Cause I don't think we're free yet.
Mm. I mean, that's
Yeah.
the answer right there. Not yet.
Hmm.
We
Yeah, not
still we
yet.
still fighting for it.
Yeah.
Definitely. All right, last one. Dr. Kelechi.
Dr. Kelechi.
Kelechi, I'm sorry. I'm always
Kelechi,
butchering
that's
names. I'm
okay.
sorry.
Nah,
Kelechi.
the first in my family.
Hmm. Yes, absolutely.
Hmm.
Well, that's
Thanks to
amazing.
God.
Yep. And you inspire me. Like I said, I'm following on social media. You don't post much, but when you do, it's always something positive. And I think you are going to inspire a lot of men and women, especially young women. When this interview come out, I'm gonna just tell all of my peoples, if you got a daughter, niece, they need to see this interview because you're young, you're beautiful, you're black, and you're doing it, and I'm so proud of you. You know,
Thank you so much.
so
That means a lot. I will continue. I'll try my best to inspire
yes,
and pay it forward. So thank you
absolutely.
so much for having me
Yeah,
today. And I really support the movement. I'll support it in any way that I can.
thank you. I appreciate it, and I'll reach out again soon. All right.
For sure.
Oh,
Thank you.
if you want to give out your websites, your social media, please feel free. Out in the video, I'll have the it come up if you want.
Thank you. Do you want me to send it to you in a message or just put it up later?
You could just say it now. You could just say it.
Oh, okay.
Yeah,
Well,
just say it.
shout out to East Carolina University,
Hmm.
Vidant Medical Center, my psych program, and Oye Global Medical Foundation. Shout out to the Oye family.
Yep.
Those are two organizations that I follow, and also the American Psychiatric Association, my
Okay.
umbrella organization for my field. So, and
Excellent.
thank you all to the psychiatrists that are doing it big out there. We
Yes.
really need
Yes.
you.
Yes. Thank you. Well, thank you again, and I appreciate you for taking the time out. I'm glad we got it done, and
Yes,
I'm gonna see you soon.
for sure.
All right. You be safe.
Thank you.
Enjoy your
Have a
night.
good night.
You too.
Take care.